This is Melinda Wisecarver for Nurse Health Assessment. I'm getting ready to do my assessment. This is Mr. Dog, and he is going to have gallbladder surgery. So for the purpose of this, because I couldn't find an otoscope and ophthalmoscope, I'm just going to use the other end of the hammer to pretend. So, hello, Mr. Puppy. My name is Melinda, and I'm going to be your nurse today. I see that you're in here today because you're going to have gallbladder surgery. Yes, I am. And I just wanted to go over your chart, look at things, and just kind of do a quick assessment by looking at your eyes, looking at your ears, your nose, listen to your heart and lungs, and just kind of checking you out and making sure everything is okay. Is that all right with you? Yes, it is. Okay, well, my first question is I have your chart here in front of me, and I was reviewing it, and I see that you have no allergies to medications or foods or anything of that such. Is that correct? Yes, it is. Okay, I also see that the only medication that you're taking is a multivitamin every day. Is that correct? Yes, it is. Not taking anything herbal, not taking anything over the counter, other kind of medications, anything like that, drinking any supplements, anything of that sort? No, I am not. Okay. Well, I want to just verify a couple more things with you from the chart to make sure everything's correct, if that's okay. That's fine. I see that you are 5'11", and you weigh 200 pounds. Is that correct? Yes, it is. Okay. I see that the last time you had anything to eat or drink was around 10 o'clock last night. Is that correct? Yes, it is. Okay. Also listed here that you are not a smoker. Is that correct? Yes, it is. I see that you've had no surgeries or any issues of that nature throughout your life history as of right now. Yes, that's correct. And as far as your family members, I see that your mother and father are in their high 80s, and they both are very healthy, very little medications that you know of. Is that correct? Yes, it is. And you have one brother and one sister, and to your knowledge, they don't have any health issues that you know of, correct? That is correct. Okay, well, thank you very much. We're going to get ready, and I'm going to just go ahead and kind of take a look at you, look at your eyes, your ears, your nose, as I said, listen to your heart and lungs, kind of press around on your belly a little bit. Are you having any pain or discomfort right now? No, I'm not. Okay, well, that's great. Okay, well, I'm just going to take my light. I'm going to have you turn here and kind of look at me just a little bit, and I want you to look at my nose. And all I'm going to do right now, we've dimmed the lights down, is I'm just going to take a look at your pupils here. Got my light on. Good. Good. Just looking to make sure that everything's good and your pupils are reacting to light the way that I want them to. Now I want you to follow your eyes, with my light, if you would. I'm going to go up, down, in, and out. Great. Everything looks good there to me. I appreciate that. Now I'm just going to take a quick look at your ears here. I'll look in. Good. Good. Okay. Do you have any hearing issues? Can't hear, or things seem too sensitive? Any ringing, buzzing, anything like that in your ears? No, I don't. What about your eyes? Do you have any blurry vision? Anything like that that's a problem? Stinging, burning, anything of your eyes? Wake up with a lot of matter in your eyes in the morning or anything? No, I don't. Okay, wonderful. Now I'm just going to take a look up here in your nose and just look at things. Good. Good. Okay. Do you have any problem with postnasal drip or anything of that kind of nature? Snoring, anything of that nature? No, ma'am, I don't. Okay, wonderful. Now I'm going to have you open your mouth for me. Good. Now I want you to give me a big smile. Great. Stick your tongue out all the way for me. Wonderful. Now I'm going to have you open your mouth again. Stick your tongue way out and good. Say ah. Good. Excellent. Okay. Now I'm just going to feel around here and just make sure we don't have any lumps or bumps or anything that shouldn't be there. That's good. I'm going to kind of hold your neck a little. I'm going to have you turn on the bed a little bit for me. And all I'm doing right here is just feeling your head, making sure everything's good. Feeling all the way down your spine. Anything hurting? Anything feeling abnormal? Pinching, pulling, burning, anything like that? No? I said, great. That's wonderful. Okay. Now what I'm going to do is I'm going to press down on your shoulders, and I'm going to try to have you resist me. Okay? So I want you to push up. Good. Good. Raise up on this shoulder for me. Great. Raise up that way. Good. Excellent. Okay. Now I'm going to take a listen to your heart. Sorry about that. And I just want you to breathe regular and just normal. Let me get my stethoscope on here. There we go. Good. Just going to count and see how your heart's doing. Okay, excellent. 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 Okay, have you lift up your left arm here for me? Excellent. Very good. Have you ever been told you have any heart murmurs, anything of that nature? Everything sounds great. Just want to make sure you've never had any history with any of that heart or anything. Nope. Ever feel your heart racing, pounding, anything of that nature? No, I haven't. Okay, wonderful. That's excellent. Now I'm going to take a listen to those lungs. Okay? So all I want you to do is open your mouth for me and take big, deep breaths in and out. Okay? Don't go too fast. I want you to hyperventilate. Deep breath. Good. Deep breath. Good. Deep breath. Deep breath. Excellent. Deep breath. Deep breath. Good. Deep breath. And deep breath. Excellent. 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 Everything sounds really good right there for me. And again, you're not a smoker, never have been, any of that stuff, correct? Correct. Okay, I'm going to have you put your arms straight out in front of me. Very good. Now I want you to lift up your arms and push against the air. There you go. Good. Now push down. Good. Okay. Excellent. Well, I think what I'm going to have you do now, if you don't mind, is I'm going to have you go ahead and lay back on the table for me. And lay back here. And I see, and I'm taking a chance and looking at your belly and everything of that nature. Everything looks good. Are you having any pain, discomfort, anything of that sort? Okay, good. Now take a listen to your heart again while you're laying down. Just breathe normal throughout all of this. Excellent. Now I'm going to listen to your belly. Sorry about that. Okay, excellent. Any trouble with your bowels at all? Are they moving regularly? Formed? Not seeing any discolorations, anything of that sort? No, I'm not. Okay, excellent. What about with your urinations? Go feel around on your belly a little bit here. You having any trouble with your urination? Stream's doing okay? You don't have any interruption in your urine stream, anything of that sort? No pain, pressure, nothing like that when you urinate? Nope. No low back trouble, anything? Nope. Okay. Any problems at all when I was pressing on your belly? No, none at all. Okay, I'm just going to feel pulses. Just check all your pulses and make sure that everything feels good. Go check right here in your groins for your femoral pulses. Those are great. And then under your knees. And then I'm going to check your dog EP and your PT. Excellent. Now I'm going to have you go ahead and sit up for me. Okay. Sorry about that. Help you get all situated there. Okay. Now I'm just going to check your reflexes here. Good. Everything's moving fine. Everything looks great. Those knees, those ankles. Excellent, excellent. Well, do you have any questions or concerns or anything of any sort for me regarding your surgery, regarding anything that we've done here today? No, I don't. Do you feel like you're prepared for your surgery? You feel like the physicians have talked to you and that you feel very well informed? Your anesthesiologist talked to you? Feel informed as far as your anesthesia goes and things of that nature? Yes, I do. One other thing I'd like to put a notation in your chart is if it's okay, first of all, we ask all surgical patients if it's okay. If you have to have any type of a blood transfusion, is that okay to do so? Yes, ma'am, it is. Okay, wonderful. Will you be having family with you during your surgery? Yes, I will. My wife and my kids. Okay, is it okay if the physician talks open and freely to all of them at the conclusion of your surgery? Yes, ma'am, it is. Okay, well, that's wonderful. Again, Mr. Puppy, it was very nice to meet you, and I'm sure things will go very well. And if you have any other questions or anything, feel free to let me know, and we can get your questions answered as you need them. Thank you very much. Thank you, and good luck with your surgery.